Any discussion on implants wouldn't be complete without discussing costs, because you really have to have an understanding of what you're getting into. Is there value in the treatment, and is it affordable? But before I go and talk about numbers, I do need to kind of give you some general information about implants, because it varies so much more, and there's a reason for it. General dentistry, in almost any city, you're going to have a variation among fees. Filling that might be $100 or $150, could be 10% more, 20% more or less in one office versus another, and maybe as much as 30% in some cases. And that's partly because each dentist, based on his experience, based on his overhead and his costs, will set his fees slightly differently. And it can vary from country to country, province to province, state to state, depending on where you live. With other types of work, what we might call major dentistry, such as crowns, dentures, bridges, the fees can vary much greater. Instead of a 10 to 20% variation, you might have as much as a 10 to 70% variation. Prosthodontists who are dental specialists in doing crowns and bridges, their fees could be 50, 60, 70% higher than, say, a general dentist. And some general dentists might also have a similar range in fees. Even consultations can vary. Some offices, a consultation could be $100, and other offices it could be 4 or 5 times that amount. So if you take a look at this slide, you'll see that in dentistry, there's a range of anywhere from 10 to 30% for fillings, crowns 10 to 70%, and consultations can be 10 to 400% difference. And here in Vancouver at this time, a single crown on a tooth can be anywhere from $900 to about $1,500. And of course, that's quite a wide range. And of course, that will change from year to year. And right now we're talking 2013. Consultations can vary anywhere from $100 to about $500. The number that you see there in blue is what our consultation fee is. If you ever called our office and asked what a consultation fee is, that's what it is today. My philosophy is to keep that reasonable and low so that people aren't averse to getting a second opinion or third opinion if they need to, and that's always very important. When we get into implants, unfortunately, the range in fees is much greater. And the way the fees are given and explained and estimates are given is much more varied and oftentimes very confusing. The reason is, in some cases, one dentist will do the surgery and another dentist will do the teeth. And so to get an idea of what's it going to cost from beginning to end, you need to go to 2 different offices to find the total cost. Personally, in our office, we do both the surgery, that be it bone grafting, replacing the implants, as well as building the teeth on top, so we can provide an estimate from everything from beginning to end. Not all dentists do that. The other difference is there could be several steps to get from A to B, to get the treatment completed. Some offices will charge for each step individually. Other offices will give a fixed price for all the steps from A to B, from beginning to end. And I've had some patients come in and been a little bit surprised because they were given a cost or an estimate for an implant. They didn't realize there's all these additional steps that need to be done thereafter, and there's going to be additional costs. And by the time they were done, it was much more expensive. So you do want to ask those questions and find out and be aware. And the other thing is, talking about a single tooth or single implant, there's 3 different parts to it, as you've seen in some of these models. There's the implant, which is the part that goes in the bone and in the jaw, and that's a surgical step. But then there's 2 other parts and 2 other steps for the teeth. There's a post that attaches to the implant, and then there's the teeth. And there's usually a separate cost for each one of these. So implant costs, for example, vary once again depending on which country you're in or which province or state you're in. There's a huge variation. Here in Canada, United States, the cost for an implant, a single implant, to place it surgically, varies anywhere from low end of about $1,700 to about $3,300 or more. The post that goes on top of the implant, that's in other words, the part that sticks through the gums, the cost of that varies anywhere from about $350 to $1,000. And then there's the final tooth, assuming you're getting a final crown that's screwed or cemented in place, varies anywhere from $900 to $1,000 up to $2,000. So if you add these up, you'll see that a single implant, if you're missing a single tooth, single implant from beginning to end can be anywhere from about $3,500 to about $7,500. And that's in 2013 prices here in Vancouver, British Columbia. And that's pretty much the same throughout Vancouver, Canada, and the United States. Our fees in our office today is about $4,400, and that has not changed in the last 5-6 years. And how do I know that? Because someone came in the other day with an estimate we gave them from 4 years ago, and it changed by about $50. So it really hasn't changed much. What I see as a trend is the costs are not going down, but they're also not going up. Fortunately, today there's a lot more demand and there's a lot more competition with implants, so the costs are staying pretty much level and pretty much staying even. However, it's still a big decision. It's one of the most expensive procedures that we do in dentistry today. So you want to take your time to ask questions and to be fully aware of what all the costs are involved. What's the total cost? Well, are there going to be any extras? Once the implant's in place, does that include the cost of the teeth? Does that include any follow-up x-rays or appointments? Also, what if it has to be surgically exposed later? And some offices may charge an extra $300 to $500 to expose that implant. So you want to be aware, is that going to be included or is that part of it? I find that very confusing when things are done in piecemeal. So personally, I like to give estimates that is everything from beginning to end. Sometimes it takes me a few extra steps. Sometimes it takes me a few steps less. That's my personal choice, my personal philosophy. Every dentist is different, and you need to have good communication with your dentist as far as how they do things in their office. Once again, if you look at the slide here on the blue on the right-hand side, you'll see that these are typically our fees. This is the range that's here in Vancouver. And once again, this has not changed much in the last 5 or 6 years. And I don't see that changing much as the time goes on because of various factors in the industry. So some things to consider. And on this slide, a couple things you need to be aware of. What does it cost to have the implant put in place? What's the surgical cost? Does this include the cost of the final teeth, the prosthetics? Is there bone grafting going to be required? And if there is that going to be an additional cost? What about temporary teeth? I'm going to have an immediate tooth in place. Is that going to be included as part of the cost, or is that something extra? What if my temporary breaks and you repair to the temporary for the 3-4 months while things are healing? Is that covered? Is there a surcharge for immediate teeth? Some dentists will charge one fee if they're just placing the implant, another one if they're having to take a tooth out and place an implant, because there can be more work involved with that type of situation. Is the final post and crown included, or is this just for the surgical step? What about follow-up visits and x-rays? Because that will need to be done. What about exposing those implants once they've been placed, if they're buried? Is that part included? What about if the implant fails? Some implants, we can place 100 implants, a certain percentage, small percentage fortunately, will not integrate. In other words, they will fail, the bone won't fuse to them. What's your policy on that? Our policy is if it fails, I'll take it out, clean it up, put another one in, and replace it at no cost. Why do I do that? How can I do that? Well, because if I follow a certain protocol, we don't see that very often. So rarely that I can offer that, and I would like to know as a patient that there is a guarantee that this implant will work. So here we see a picture of a single implant post final crown that's been done for a patient. This is around $4,400, $4,500 in our office today in 2013. In Vancouver today, that same person could get a range anywhere from about $3,700, and I've seen people coming in with fees as much as $7,000 for the exact same tooth. And that's the reality, that's the range that we see today in Vancouver. Where that's going to go and how that's going to change over the future, I really don't know, but it seems, my opinion, and this is strictly my opinion, is that the fees will going to stabilize, not going to come down considerably less. They'll always be relatively more expensive than other types of dentistry, but at the same time, they're not going to keep escalating, and I think we're going to see implant dentistry become more and more affordable as time goes on. Another situation showing 2 implants with a denture, placing 2 implants, putting some posts in, using the existing denture and retrofitting the denture. We're looking about $5,600 today. Once again, there's about a 25-30% range depending on who's doing that and which dentist and which office you've gone to. If we have a similar situation where we have 2 implants, but now we add a bar, basically it's going to be a little more expensive. It's the same as doing 2 implants. The difference is we now have to have a bar manufacturer, and it adds a couple $1,000s to the cost. And it breaks down, here's the implants and the bar cost to make a denture on top. Traditional denture is about $900 to $1,200. Making a lower denture fitting to implants is more expensive, and you're looking about $2,000 to do something like that. When we get into 4 implants, it's very similar. The denture costs are the same. The difference is we've got more implants, so the surgical fee is higher, and we've got a longer bar, so the parts and components and the materials required to make that bar is more expensive. So the implant and bar is more expensive. Upper and lower denture is about the same. A traditional standard upper denture sitting on the gums is about $900 to $1,000. The lower denture that fits on top of the implant is a couple $1,000s, so that hence you see the total fee of a standard upper denture, lower implant, bar over denture is about $3,200. Getting into upper implants, it's really no different. Upper implants, lower implants is not much different. The difference is we've got more implants. In this case, we've got 6 implants. And so the extra implants going from 2 to 4 to 6 becomes more expensive, plus the bar becomes a little more expensive. The denture is still the same, whether the denture is fitting on 2 implants, 4 or 6. In our office, that cost of that denture is exactly the same. We start getting into permanent crowns and bridges. The implant costs are the same, there's no difference there. Where the difference comes in is the type of teeth that go in place. So placing implants is the same whether placing them for an overdenture or placing them for permanent crowns. But the posts and the type of crowns that go in place, those are going to be significantly more expensive if we're placing crowns as opposed to making a denture that goes into place. So although these are very similar in that they both have the same base and the same implants and number of implants that go in place, the cost of making one of these dentures that get screwed in place is significantly less than making permanent crowns that go in place, and certainly more than making a denture that snaps into place. And so if we're doing an upper, we're typically looking around $40,000, and the reason for the plus sign there is because a lot of times people are missing a lot of bone tissue and soft tissue, and they need some grafting if they're going to have permanent teeth. So that is where it becomes significantly more variable. Once again, these are what you see. Once again, what you see in blue is typically our fees. For an upper full fixed permanent teeth on 8 implants, I've had people coming in where they've had quotes anywhere from $35,000 up to well over $100,000 for the exact same treatment. Why there's such a range in fees from one office to another, there's many reasons and varied reasons for that, between costs of overhead, experience, and so on. My philosophy is if I can keep the fees as reasonable as possible, I can provide more services to more people, and I can be helping more people achieve their ultimate goal dentally and functionally. Lower implants and lower permanent crowns, typically we need fewer implants so that it's going to be less expensive. Oftentimes we may still need some bone grafting, and therefore that's why we have the plus sign there. If there's bone grafting required, that might be in addition to what you see there. And as far as bone grafting, what's the cost there? That's too hard to explain. That's so variable because there's so many different ways of grafting bones. Some are very simple, some are more complex, and it depends. So it depends on the type of procedure that we're doing as well as the type of materials we're using. It can be as little as a few $100s. It can be as much as $3,000 to $4,000 per site. So hopefully this will give you some sense of what the costs are as far as implant dentistry. Like I said, it's certainly one of the most expensive things that we do in dentistry. However, I have yet to have anybody come in afterwards and say, you know what, that really wasn't worth it. I've wasted my money. In fact, quite the opposite. I've had people come in and say, wow, I'm so glad I've done it. I've done this. I wish I'd done it many years earlier. There's tremendous value in implant dentistry. As much as it can seem like it's a large expense at the beginning, the value will be achieved over many, many years because they do work well. They're holding up better than our traditional dentistry. They're lasting longer. You will get good value. However, I do tell you to treat it, and I recommend treat it like a major purchase. And like any major purchase, whether you're buying a car, a house, or even an appliance, you're going to do some looking around. You're going to find out which is the right one for you. You're going to find who's the best person to provide that for you. You want to have trust with the person who's providing the procedures, trust their skills, trust what they're doing, what they can do for you, trust that they can provide the end result that you're looking, and have faith and trust that you're going to receive good value for the amount of money that you're spending.